Hello everyone, welcome to Texture Math. In this session, we are going to talk about another very important topic related to medical coding anatomy, where we will be mainly discussing about the frontal coronal plane. In our last session, we talked about the sagittal plane. So this session is in the continuation of the same, where we will be mainly talking about the frontal coronal plane. So we will proceed in the same way, like firstly I'll walk you through the definition, notes and the meaning of these words, and then later I will share some pointers that will help you to understand the concept properly, and also we will discuss the interview questions and tricks that will help you to prepare well for your interviews and examination. Okay, so before we move with this session, I would like to recommend you to please go and check out the previously released session first, because they all are in proper sequence and sync. So if you follow it sequentially, then it would be much more easier for you to understand the ongoing topic, because for time being we are just mainly focusing on what is frontal coronal plane, but prior to that you should know about other types of plane that we covered, like sagittal plane, and at least you should know what is body plane, what are body planes, right? So for that you can refer the Texture Math digital course book, which is freely available in the description box. There you will find thousands of sessions available in both Hindi as well as English language. So without any language barrier, you can easily consume the content, and in case if you want to ask any questions, you can simply reach out to me through comment section. I would be more than happy to answer all your questions there. Okay. Alright, so let's get started and just look at this image carefully, because this is the image of frontal coronal plane. So if you understand this image, things would be very easy for. So this is the imaginary disc which is passed from the body, dividing the body into front and back portion. Okay, now if you know about this, like if you have looked at this image, now you can go through the notes, it will give you the more clarity. Okay, so let's see the definition of the frontal plane. The frontal plane, that is also called as coronal plane, is a vertical plane that runs side to side through the body, dividing into anterior, that is front, and posterior, that is back portion. So you can refer the diagram again. Yes, it's going through side by side and dividing the body into front and back. Now you can see frontal is coronal plane, a vertical side, like we concluded this, side to side plane that divides the body into front and back section. Now if we look at the origin of the word, the origin is quite simple. Like frontal means, the term frontal comes from the fact that this plane runs parallel to the forehead frontal bone, and that is why we are referring it as frontal, because the frontal bone is the bone of the forehead, and this plane runs in the section in the same direction as the flat surface of the forehead. Okay, now look at the coronal. The term coronal comes from the Latin word corona, that means crown. Okay, so this refers the coronal structure of the skull, the line where the frontal bone meets the two parietal bone at the top of the head, and this suture runs side to side across top of the skull, exactly like the direction this plane travels through the body. And we all know that a crown sits on the head, running from the side to side, giving this plane its name, that is coronal plane. So both name frontal and coronal refer to the same plane and are completely interchangeable, but in clinical practice and radiology, coronal is the more commonly used term. Okay, now we'll move to the next part of the section, where we will talk about what does the frontal and coronal plane divide, like how it divides the body. So basically it divides the body into two portions, an anterior portion, that is front portion, and a posterior portion, that is back portion. And this division relates directly to the directional term anterior and posterior. This is the direct link between the frontal plane and the anterior posterior directional relationship. Now if you look at the if the direction of the frontal and coronal plane, it's quite clear. Like to clearly understand the direction of this plane, it runs vertically from the top of the head down to the feet. It runs side to side from the left side of the body to the right side. It does not run front to back, that is sagittal plane. Okay, so if it is going side like a front to back, it is a sagittal plane. So you can just simply imagine a flat wall that you are standing directly in front of. The wall represents the frontal coronal plane passing through your body, separating your front half and back half. Okay, now let's compare it, both the planes. Okay, so here you can see I have noted down 3 columns: feature, sagittal plane and frontal coronal plane. Now in feature we have orientation. So orientation wise, sagittal plane is vertical and frontal and coronal plane is also vertical. Direction of cut in sagittal plane is front to back, and in case of frontal and coronal it is side to side. It divides the body into right and left portion, but in case of frontal and coronal plane it divides the body into anterior and posterior, that is front and back portion. If we compare it with the related directional terms, so sagittal plane is related to the medial and lateral, whereas frontal is related to anterior and posterior. Now, for which type of examination view is produced? So view is like here, in case we will go for side view. In frontal and coronal plane we will go with a front or back view. In sagittal, side view, and frontal and coronal, front and back view. So we can say both planes are vertical, but they run in perpendicular direction to each other. Sagittal run front to back, while coronal run side to side. Okay, so these are the comparison. Now let's see what are the structures viewed in the frontal coronal plane. So when the body is divided along with the frontal coronal plane, the resulting section shows a structure from the front or back view. Like anterior portion contains face, eyes, nose, mouth, forehead, anterior chest wall, anterior abdominal wall, anterior surface of limb. Similarly, if we talk about the posterior portion, it shows the back of the skull, posterior neck muscle, scapulae, erectus spinae muscle, posterior surface of limbs. So this is how you can assume, like, these are the body parts that comes in anterior portion and posterior portion view. Now let's see how it is utilized in medical coding. So in medical coding, there are, like, you can see there are 2 columns. In one column I have noted down the medical term, and in another one I have noted down the meaning. The first is coronal MRI, an MRI image taken in the coronal plane showing a front view. Coronal CT sinus, standard CT scan for the sinuses taken from the coronal plane used before the sinus surgery. Coronal suture, the skull suture between the frontal and parietal bone running side to side. Coronal incision, a surgical incision running from ear to ear over top of the head. Coronal plane deformity, a joint of spinal deformity in the side to side direction, including the Varus and Valgus. Varus deformity, angulation toward the midline of the coronal plane, bow-legged knees. Valgus deformity, an angulation away from the midline of the coronal plane, knock-kneed appearance. And scoliosis, abnormal lateral side to side curvature of the spine, a coronal plane deformity. So these are just an example where we have utilized the terminology that is coronal, which gives you the imagination view like we just discussed. So just remind that diagram in your mind, it will help you to understand your questions. Okay, now we have learned so many things, so how we will keep it in mind. So first trip is frontal, start with front, that means this is a plane, separate the front and back. So imagine a flat glass wall standing right in front of you. The wall runs from your from your left side to right side, side to side. That imaginary wall is frontal coronal plane. Everything in front of the wall is interior, and everything behind that wall is posterior. Another way to remember is coronal means crown, right? A crown sits on your head running side to side. This plane runs in the same direction as a crown, side to side, dividing the front from the back. So yeah, I think with this we are done with the frontal and coronal plane. And now there is one question for all of you, and today's question is, what is sagitta? I'm sure you already know the answer of this question because we have discussed this thing in detail multiple times. So please do share your knowledge in the comments section so that others can take a reference from it. And also, like, if you want to like help others, then your answers will help others as well. Why? Because let's say if they are not aware of this thing, so they can simply refer the structure. They can simply refer the comment section to get the knowledge. Also, when you write the comments in the comment section, it gives me the instruction that you are referring these sessions, you are learning from it, and accordingly I will release the sessions, upcoming sessions. Okay, so more the number of comments, more the sessions will be published. So yeah, that's all for today. See you in the next session with new topics. So thank you for watching TechSharemeth.